Thank you so much for joining us. Today we have a great topic, so you're going to hear us all talk very fast because we've tried to pack in way too much information. So we might also go a few minutes over. If you do have to leave, we understand it is recorded and you can catch up, but we are hoping to fit a lot of great details in for you today. So I'm Aimee St. Arnaud. I work for Best Friends Animal Society, and I am also a co-owner of 2 full-service private practices. And we focus on removing barriers to care and to providing a sustainable business model that we are working to share with other vet clinics and nonprofits so that they can also provide access to care. And also we have with us, we've got 2 Toledo people representing from Ohio. We've got Dr. Janet Hoy-Gerlach, and I'm going to let her introduce herself.
Hi, thank you, Aimee. So my name is Janet Hoy-Gerlach. I am a social worker who's worked in public mental health for a couple decades now, and I am also a social work professor at the University of Toledo. And a lot of my work currently focuses twofold. One is on the health and mental health benefits of the human-animal bond, and the other is around working with human health care and service providers to be more responsive to people who have pets and companion animals. So toward that end, I authored, along with a colleague, a book, Human Animal Interactions, a social work guide that really details the different ways that pets are important in human lives. And it's really much more than being an animal person, although that helps. It's about being a competent social service or healthcare professional. So I'm going to be sharing with you more about ways to reach across and partner to support people with animals. And next, we will hear from Dr. Prioleau.
Hi, everybody. My name is Dr. Derrick Prioleau, currently living in Dallas, Texas right now and working full-time at the SPCA of Texas. I've been employed at the SPCA now for about 4 years. And, you know, shout out to all the SPCA employees because we really work hard there. And I'm just going to be talking about what I've done in the community since I've been there, and also what the SPCA does as a complete whole for the Dallas community. Okay. And next will be Geraldine from San Diego.
Thanks, Dr. Prioleau. Hi, everyone. My name is Geraldine De Silva, and I'm the Director of Human Animal Support Services at San Diego Humane Society. And I love the organization I work for, as well as all the work that all of us are doing around the country right now to change the way we provide services to people with pets. So with that, let's get started. So today we're talking about supporting both ends of the leash. So yeah, I thought I'd start a little bit briefly about my background. I grew up in India, and as you can see from the pictures here, there were all kinds of animals on the street. There were dogs, cats, cows, even elephants and camels in the middle of traffic. And I found myself often like trying to rescue dogs and puppies that were hit and run over by cars, and found them like dying in my arms, and even rescuing dogs from dog catchers, which was a really cruel act to witness. I also studied the caste system in India and saw how there was gender discrimination, not just in villages, but also in the urban areas. And all my experiences led me to San Diego Humane Society. And along the way, when I first left India, I never anticipated seeing poverty in developed countries. And when I saw seniors trying to fend for themselves, or people in the rain and in the cold in Scotland struggling alone with their dogs, it really left a huge impact on me. Next slide, please. So leading to the philosophy at San Diego Humane Society, while I'm going to give you an overview of all the services that we provide at San Diego Humane Society, the reality is that people's lives are complicated, and many of those that we help don't fit into a neat little box. So we have a philosophy of non-judgment, which requires an equality in how we treat others, whether it's our clients, our donors, our volunteers, or our staff. So we may not be able to solve all the problems and everyone's problems, though we can treat everyone with the dignity and respect that they deserve. And we, as an organization, try to help everyone that walks through our doors. So we've, as an organization, now adopted the model that the former PAWS program had, and now all of us meet people where they are at their time of crisis. Most families that we work with say that their pets give them a purpose or a reason to live. So we are essentially providing help where there is otherwise none available. Next. So why access to care matters? So I feel so lucky to be able to do what I love to do. And when we first started providing safety net services back in 1993, it was when we had the AIDS pandemic and people were isolated and living at home, homebound with their pets. And here we are in the COVID pandemic where people are isolated with their pets and needing resources. So at San Diego Humane Society, we help people keep their pets by providing vital resources and support. So vulnerable pet families, whether they're seniors, chronically ill, terminally ill, unemployed, victims of domestic violence, or people facing homelessness, can all come to us for support. Let me take you on a little journey. Imagine you are struggling to make ends meet, and you're isolated, and you fall ill. You need to go to the hospital, but have no one to leave your dog with. Or imagine you needed to choose between paying for medication for yourself or food for your cat. These are the circumstances that our clients come to us with when they run out of help and hope, and our goal is to keep these families together. So today I'm going to share like a big picture view of our work, as well as some specific examples of the lives we've impacted. Next. So before I talk about our safety net, a short story is on one of our clients by the name of Ray. And Ray was a senior and chronically ill for many, many years. And he was homebound, and we provided all the support and services he needed for his dog Licorice, including a delivery of pet food and supplies, transportation to vet appointments, and free medication. And right till the end of his life, Ray lived because he didn't want to leave his dog Licorice alone. And so as he prepared to die, we supported him, and he came back from the hospital, and we got Licorice by his side till he passed away. And then we provided foster care to Licorice, and then found her a home where she retired from being a service dog. And now she lives on a huge property with 2 dogs. She's learned to swim, and she has a wonderful life. But just imagine if we hadn't provided the services that Ray needed to have Licorice by his side. It would have changed everything in the way his life ended. And so these are all the safety net services we provide at San Diego Humane Society. And today I'm just talking about a couple of the services that we provide. Next. So our Community Resource Center is typically the first point of contact for any of our guests. And we connect people with our online resource guide, which is pretty extensive. And this is just a snapshot of it. And each of these lists here are pretty comprehensive. They are based on region and on services here in San Diego. And they also have a really convenient downloadable PDF, so people can have a hard copy for themselves if they need it. And Aimee's going to provide resources at the end and a link to our website and these resources in case anyone's interested. Next. So people need help for many reasons. And as we know so well, losing a pet is so hard, and losing a pet that's still living is even harder. So individuals and families come to San Diego Humane Society for so many reasons. It could be illness, abuse, poverty, isolation, injury, and more. And we understand that each client has their own story, and every single one of them loves their pet beyond measure. Sometimes these bonds are closer to the bonds that many of us have, if we can even imagine that, because these pets are their entire support system. So when someone comes to us in need with their unique story, it requires all of us, staff and volunteers, to be creative, thoughtful, and compassionate to provide the help that they need. We recognize that those people are whole people with intertwined needs. So they may have medical challenges and financial challenges, and then their cat is their sole companion who now needs surgery. Or the individuals fleeing an abusive situation, living in their car and took their dog with them, but still needs a way to find a way to go to job interviews. So our organization as a whole is striving to meet every single one of these situations with a commitment to support their needs, which often means we're navigating numerous complexities and social service issues. Next. So partnerships and immersion in our community is so important because it takes time. We have a very collaborative approach, and we partner in any which way that we can. We partner with our teams within the organization, with our volunteers. We partner with anyone that can provide us with food, whether it's individuals, pet stores, larger organizations like the Petco Foundation or Greater Good. We also partner with vet clinics. We partner with over 100 vet clinics in San Diego, rescue partners, churches, and human service groups like senior centers and community centers. We even sit on the Domestic Violence Council at San Diego and on boards, which are non-animal welfare groups here in San Diego. Next. So our community pet pantry was founded in 1993. And at that time, it was in response to our community's need when there was a lady who came to us who was living in her car with her dogs, and she temporarily needed a bag of food. We then found out that her circumstances changed when we received a donation all the way from Atlanta, and we found out that it was that same lady who had now become a donor. So we realized so well that people's circumstances can change for better or for worse. And today, we've provided over 2 million meals in the last 1 year to San Diego pet families in need. And out of that, 1 million meals were provided just since the start of the pandemic and since we started distributing in March. So homeless support is a large part of what we do. And what we do is we piggyback on other organizations who already have services for humans experiencing homelessness, because we found we don't want to reinvent the wheel, and we piggyback on their resource fairs. Next. So Stand Down San Diego is one of the 2 annual events like Project Homeless Connect that happens in San Diego, and we provide vet care and pet care for 3 days and 2 nights, including overnight care, so that when people access resources for themselves, they can rest assured that their pets are taken care of. Because we found that they share such a close bond that they never separated from their pets when they're facing homelessness. And so we make sure that their pets receive all the care that they need while they're with us for those 3 days. So one of our partners at Stand Down and Project Homeless Connect is Banfield Foundation, and they bring their team and their supplies, and we schedule the appointments in 15-minute increments, and the families come in with their pets, and they're there when their pet receives vet care. And it's a pretty incredible experience to witness. Next. So access to veterinary care. That's a huge topic these days, and we are looking at what we have right now in terms of shelter medicine care and our community-facing vet care. And we have a number of programs that we offer already, but the cost of veterinary care, as we know, is a big barrier to access. And it's one of the most common and pressing problems facing pet owners, not just in San Diego, but around our nation. Current estimates are that the average pet owner spends anywhere from $9,000 to $13,000 on vet care for their pets, or more. I would imagine that studies overlooked underserved populations who are not in a position to spend a fraction of that amount on pets, or who have endless love to give them. So our organization focuses on intervening for those pet owners in San Diego who are at most risk, who are facing giving up their pets because they cannot afford vet care. But we've merely scratched the surface with what we're doing. We also offer vet vouchers. We have a paperless system, And that can be adapted to a coupon system for organizations that have a smaller budget or a smaller staff infrastructure. But it works really well because there's no money transaction between the organization and our clients, and it's strictly between the vet offices and our organization. We want to be able to expand our vet vouchers, which is primarily for vet care and prescription food, to spay neuter, which we've soft launched right now, as well as to grooming and training in the future. And Aimee is also going to be talking about transportation vouchers, which we're working on right now. Next. So community pet events evolved again out of our interaction with the community, because we were going door to door and trying to offer services and asking people to come to our campus to receive these services, and there were a whole lot of no-shows. So we asked them what they needed, and they asked us to come into the community with our services, and so that's exactly what we did. So we started that in 2016, and since then we've had 18 community pet events, sometimes people over coming in like at 6 o'clock in the morning when an event starts at 10, and we've had over 600 and 700 people attending in a 3-hour event. And at these events, we offer everything from free vaccines, microchipping. We've even had spay neuter appointments, and we have human service partners. We even call the Spanish radio station over, and a food truck. So it becomes like a family event and a resource fair for everyone in the community. And it's been very, very successful. And of course, this was pre-COVID. So we're looking at different ways to do it now as the restrictions get lifted. Next. This is just an image of one of our recent events when there was a line that went onto the street and we had to call in for backup resources and staff. And now I want to talk a little bit about our community vet services really quick, because I know I'm running out of time. But it is a really proactive, consistent approach that we've had, and we want to expand that as we go forward. So I talked about vet vouchers, but we also have drive-through vaccine and microchipping clinics daily at all of our campuses. We've rolled out a spay neuter voucher program, and we're looking at a mobile clinic offering preventative care in low-income targeted communities, along with pop-up clinics, which could offer different formats of access to care, which could be just providing resources or a little bit of humane education or behavior tips. It could be a mix or all of them at once. And like I said, transportation countywide. Yeah. So domestic violence. So we partner with organizations that support people who are fleeing a domestic violence situation. And we are regularly at San Diego Domestic Violence Council meetings, like I said. We had a young lady that showed up at our door once, and she had always lived in what she said was a big mansion with her dogs and her children. And here she was with a car that had windows taped with duct tape. And she didn't even know how to bring herself to ask for help. And we spent the time trying to talk to her because we could see her situation, and we found out that she was fleeing a domestic violence situation. So we offered her all the help she needed so that she could get her life back in order. We boarded her dogs for 3 months. We didn't have emergency boarding at our campus at the time, so we reached out to community partners. We even provided her deodorizer and whatever she needed customized to her needs at the time, with her pets living in her car. And she eventually got a dog. She got a job, and then she got her dogs back and her life back in order. So sometimes it might be just a bag of food or emergency boarding, but it all could end up with saving a person's life and making a huge impact. So that led us to find out that there were safe parking lots where people were living in their cars with their dogs. And so we decided to bring our services into the community and to these safe parking lots, where we kept it very low key and we never advertised those services. And we've had vaccine clinics and microchipping and a whole host of specialized services just for them in these parking lots. So emergency boarding is something that we're still trying to grow, and we've reached out to doggy daycare centers in San Diego, and we have quite a few partners, but now that we know we have space on campus, we hope to be able to expand that and offer that a little more. And just to give you a short story about emergency boarding, how we not only save animals' lives, but also people's lives. We had a guest by the name of Joseph, and he came in with his dog Olive Oil, and he couldn't even tell us what his needs were because he was gasping for breath. And we found out that he needed to get to the ER, and so we immediately boarded his dog, and he was rushed to the ER. And when he came back to collect his dog, he still had his IV tubes like taped to his arm. And he told us that the ER doctors told him that if he hadn't made it there on time, he would not be alive today. So that's the difference and the impact of the work we can do. And so just to sum up, access to care is always evolving. And we need to understand that access to care will continue to evolve. We need to continue to listen to our community and remind ourselves that these stories do not fit in a neat little box. We will also need to constantly look at how we are providing services and adapt them to each story and situation to keep pets in their homes and with those that they love. So thank you so much for listening. If you have any questions, feel free to email me, or we have a host of resources on our website. And yeah, now I'd like to hand it over to Dr. Prioleau.
Okay, nice job, Geraldine. Okay, so the things that's going on in at San Diego with Geraldine, you're going to see some similarities in mine. And, you know, that just goes to show that these methods really do work, especially whenever it comes to community service. All right, so just want to give you all a brief history of the SPCA of Texas. It was founded as a nonprofit organization in like the 1930s, so it's like really old. And, you know, within that longevity, it has really established itself with a strong reputation in the North Texas community. So we right now have 4 facilities, 2 in Dallas County, 1 in McKinney, Texas, and we just acquired a new shelter in Ellis County, and we're happy that they're on the team too. We see many, many types of animals, from your typical cats and dogs, some birds, sometimes even reptiles, and we also have a really good large animal component in, at the McKinney, Texas location. All right, so let's get started. You can go ahead to the next. Yes. All right. So when I was handed the topic of the discussion, I just came up with the question to kind of guide us through everything. And this is the question right here. How do we encourage and improve animal health in the community? So I came up with 3 different answers, and with all these different answers, what I'm gonna do is I'm gonna basically break it down, and I'm gonna provide some examples with what the SPCA organization is doing, and also some things that I've done, okay? Next. All right, so the very first one is, what you need to do is establish a supportable and a reliable resource with the purpose to serve the community. Now, when I first came up with this answer, I was just thinking about money because, you know, it's important, you need it. But before you have funding, you know, at least you have an idea and you got a voice. So it's important to, you know, spread the word about what you're trying to do, and you'll be surprised to see how the funds will generously flow in. So an example of a huge resource that the SPCA of Texas has is the Pet Resource Center. And there's a lot of allocated funds that come through the Pet Resource Center. And, you know, this sole mission is basically to help out those that really don't have the funds to care for their pets. And it can be something as simple as you know, just doing vaccines, you know. But they do an outstanding job with providing funds for people in emergency situations. I cannot tell you how many pyometras I have done, and the rest of the veterinarians at the SPCA of Texas. We've saved a lot of dogs just from pyometras because of the Pet Resource Center. So it's a true blessing to have the Resource Center so that we can, prevent people from having to surrender their animals or euthanize their animals when they can be saved with the funds that we have. Okay, next. All right, this is an example of one of the things that the Pet Resource Center provides. I know Geraldine touched on their food pantry. So we actually get a lot of food in too. The food is donated or it is purchased, and we will personally do deliveries from door to door to our clients that need food for their dogs. And it's surprising because I've met clients that are more adamant about feeding their dogs or their cats before they try to feed themselves. So it's we're always there for the clients and the capacity that they need them, and food is definitely important, and we're glad to have this resource and to spread it with the rest of the community. Now, this is something that Aimee wanted me to touch on because she is real acquainted with the way that we do things at the SPCA, and we have a call
Amazing.
center. We have a call center at the SPCA. Now, this isn't like your typical you're calling American Airlines and they make you wait 30 minutes to talk to somebody. This is there's always somebody that will answer, and you're going to be talking to a real person. And the call center takes in calls for adoptions, maybe somebody that wants to set up an appointment. Somebody might have an emergency and they're looking for help for their animal. And what this graph, what the table is showing is, at the top is the dates, and all those are individual calls that someone is taking in. And you can see all the way to the right, those are the total number of calls throughout those dates. And at the very bottom right-hand corner, that's the total number of calls that our employees are taking in. So we're always trying to be there for the community, and this is a great example of that. Okay, this is the second answer that I came up with to the question that I proposed, and that is you have to find disparities within the community's animal health infrastructure. Hold on a second. Can you go back? Sorry. Yes, you have to find disparities within the community's animal health infrastructure so that you can provide progressive and perpetual solutions in return. I know that's a loaded answer, but it's very important. Disparities, it's always some poverty. Geraldine talked about, homeless and people that are, might be abused. But what's happening out there. So you have to identify the emptiness or the gap that's in your community, okay? And once you find that out or discover it, you have to come up with something that is progressive and a perpetual solution. So it's going to be something that is everlasting. You don't have to change it again. So the perfect example of that is the Southern Dallas Pet Initiative. This was launched in 2017, and the mission of the Southern Dallas Pet Initiative is to find those disparities and provide solutions for the community. So with that, this was, of course, garnered by a very, very generous grant. And with that, we've been able to change the entire community of Southern Dallas with having people by basically promoting exceptional animal care for everyone. We've been doing vaccines. We've been doing spays and neuters. So it's been a lot of stuff. And one of the things that I do want to touch on that gave birth to the Southern Dallas Initiative is the mobile veterinary clinic that we have now. And I think that's on the next slide. Yes. So the mobile veterinary team is truly amazing. That's Dr. Bowden right there, and one of our technicians, Blanca, vaccinating a dog. And the mobile veterinary team is really strategic because, we're basically bringing the clinic to the community. So we try to pick a place that is popular, some place that everybody knows about, and you'll be surprised at just how many people show up, for help. People will see the mobile veterinary bus, and they'll run home and go pick their dog up, just to get the help that they need at that time. So it's a really great program that we've got going on. The community outreach program that we have is basically the catalyst that is finding the disparities and promoting solutions in the community. The reason why I say that is because the outreach program is extremely personal. They actually are going door to door, and the community is actually seeing their face. So, that's important, because if you have somebody that's actually, talking to you directly, and not just doing a text message, but actually talking to you directly about what's going on, it creates a more outstanding and well-established relationship, so that you can then do more with that. So I wanted to tell a couple of stories. There's two stories that I have that I think really hit home with, locating disparities and then providing some solutions, all within the Southern Dallas Initiative and involving our outreach team. This is Mr. Walker right here. And Mr. Walker was not expecting the SPCA to show up at his door. He actually shut the door in the face of one of our employees that, was just trying to get to know the neighborhood, But you have to look at this in his eyes. He saw a stranger that was advocating for pets, and he loves his pets so much. So he had some other ideas. But, it took 5 months for Mr. Walker to finally warm up to the outreach team and to the SPCA and what our mission was. And when he did, we were able to fix one of his pets, and also one of his dogs had an ingrown toenail, both of which were done by Dr. Heinfield at Village Fair location. So I think the best part about this story is that after the SPCA, took good care of his dogs, a couple days later, he asked us to come back, and so he could introduce us to his neighbors. So that's the perpetual relationship of the solution. He was satisfied with what we were doing and how we were able to help his dogs. We were able to sign up, I think, 2 of his neighbors' dogs for surgeries that needed to be done. So it was truly great to have Mr. Walker and the outreach team as a catalyst. All right, this story right here is really, really good. So this is Oreo, and Oreo is from Oak Cliff. For those listeners that aren't familiar with Dallas, Oak Cliff is a really, really large community in southern Dallas, and there's a lot of culture, a lot of history, a lot of good food, and a lot of dogs. So Oreo is really unique because Oreo's owner is disabled. So, he wasn't able to walk Oreo like he used to. So what he would do is he would put Oreo on the cable, on that tether. So, Oreo could, just walk the house and, get his exercise and use the restroom. This owner didn't know that tethering is now considered illegal in the city of Dallas. So, he wasn't trying to break the law. He wasn't trying to do anything, uh, you know, belligerent at all. He was just doing something that he knew. Um, it's just unfortunate that, this idea of tethering is now considered something unconventional. Uh, so, the SPCA came in and, he was in tears, he was crying because he was at the risk of losing his dog and, because he was going to have to pay a citation for which he couldn't afford to pay for. So we actually have some solutions for that. And this is the solution, building a dog run outside. This has actually been led by Duck Team 6, which is another nonprofit in the city of Dallas. They do a really awesome job, and they've taken on this lead by storm with a lot of these dog run builds. They've been doing probably one or two, I think, about 2 a week or so, but they've really done an awesome job with this. So this is the progressive solution. We're taking an unconventional idea of tethering and doing something progressive by building a outside run that is of quality standards, so that Oreo can have his space to run around and just be a dog. And that is Oreo right there. So he looks like a brand new dog. He's in his new house and he's happy. So this is really what it's all about. Next. And it's what I would call a win-win-win situation because we have a happy dog, we have a happy owner, and nobody gonna get no citation and nobody's going to the pound. So we're keeping everybody together. All right, this is the last point that I want to touch on in regards to how we encourage and improve veterinary health in the community. And it definitely is something that has to start with yourself. So that's why I put you have to challenge yourself. Next. Yes, so you definitely have to challenge yourself. So this is something that I've learned the last 4 years, while practicing in the community is, it really is, you just have to challenge yourself because I realized that you can't save every animal in a clinical setting. It takes more than just treating heartworm disease and, you could do all the surgeries in the world, but, you're not going to save every animal unless you do something different. So you got to do something outside the box. And that's something that I was invited to do and inspired to do. And it's really changed my outlook on ways that you can save animals. So, if there's other veterinarians listening, think of ways that you can, challenge yourself outside of the clinical setting. If there's politicians listening, think of ways that you can challenge yourself and save animals instead of making laws. So, it's really important that we, come up with ways that actually help the community. And, I think we'll be all right by doing that. And I just wanted to give some special thanks to Maddie's Farm for inviting me, Meredith, and Maddie Yeaman for the presentation, and also Rosamond Rosa for the outreach stories.
And while I'm transitioning over to me, I was hoping, Dr. Prioleau, you could talk, because one of the things I know that I heard about you is that you go in and inspire young people to see that they can be a veterinarian as well. And I was just wondering if you could talk about that while I get adjusted.
Yeah, so I've done some things with the community. In that last image, I don't know if y'all saw that I was at the rec center, and it was pre-COVID. Nobody had on masks, but that was really inspirational because, I just went to community, saw kids that looked like me, and just wanted to give them, just some more ideas about, what you can do. And it was also special too because those kids actually knew some things about the SPCA that I didn't know about. So, it's good that the SPCA of Texas has that impression on the Dallas community. So yeah.
Excellent. So thank you for that. So what I love about both the SPCA of Texas and about San Diego Humane is that they're the nonprofits really taking the lead on this. But I'm going to talk now from the perspective of private practices and how private practices can play a role in partnering with nonprofits to do this. And I think I've kind of looked at the list of who's on, and there are like some amazing people doing some amazing thing on this call. But so I think some of this stuff we probably know, but I think it's always good to really understand what problem we're solving for. And I've heard this so many times: if you can't afford a pet, you shouldn't have one. And I'll be honest, I've thought it in the past. And I think what's so exciting to me about the things coming out of COVID and what we're seeing with Haas and some of the new way of thinking is that we're realizing that, we used to think that if a person couldn't afford pet care for their pet, that they needed to surrender them so we could get them into a better home. And now we're starting to realize that removing a pet from a loved home simply because they don't have funds in that moment is not what's best for that pet or for that family. And so why would we remove a pet that already has a home, have to put in all that time and energy and having to adopt them back out? And Pima Animal Centers actually looked at it and said it takes about $400 to take in and rehome a pet, when we can help keep that pet in that home sometimes for so much less, and it's just so much better. And I think what we've learned all around from this is that we're all one pandemic or one loss away from being a person who can't afford care. So it's not those people, it's all of us. And I think that that's a really important thing, is that it really is time for us to start looking at not only the pet, but who's on the other end of the leash and that connection between the pet and the human. And I'm really excited we're starting to do that. And I think if we look at sheltering right now, we look at the top two reasons for surrender. One is housing, that either people can't find pet-friendly housing, or they're having to give up their pets because of the housing, because they're over the limit, or because they can't afford the pet deposit. And number two is cost. And that usually comes down to vet care being the number one reason. And we are seeing economic euthanasia. So we know from the ASPCA and other studies that households under 50,000 are more likely to surrender a pet. And that's not because they're bad households, but that's because a lot of times they have less access to resources, or have less in their community for them. So the more we can provide in these areas, the more we can start to solve for the reasons of surrender. So this is Blue, who came into Downtown Dog Rescue in Los Angeles, and she had pyometra. And at that point, when it gets to where it's an advanced case, it often can be anywhere from $1,500 to $2,000 because it's considered an emergency. And she had been laid off for COVID for 3 months, and she didn't have any income. And I think it's really easy when you're the vet clinic or you're the person seeing that and go, well, why didn't she fix her pet? Doesn't she know about spay neuter? Why didn't she do that? But when we look at it from the other perspective, and I think this sometimes is the hard thing, is when we look at reasons, we find that there generally is a really good underlying reason. Maybe she'd had a dog before that had died or had complications when she got a spay. Maybe she thought the dog was 8 years old and didn't need to be spayed at that age. For whatever reason, though, instead of shaming, Downtown Dog Rescue said, you know what? We're here to help you, and we're going to make sure that you keep your dog that you have loved for 8 years in your home. And they did just that by providing the help with that surgery. So I think that's what's important, is sometimes to not just look at it from our perspective, but think about some other reasons and listen. And I think that's the number one thing I've learned, is that we have to listen to the why, and that will really help us come up with innovative solutions. And I think here's another really good example. A lot of times we think, well, why didn't somebody go get vet care? Because we know there's a shortage of veterinarians right now nationwide as it is, but in a lot of communities, it's even worse. So this is Pets for Life data in Atlanta. And if you look at this, the blue dots are pet supply stores, the olive green dots are vet offices, and then the other big green area is where Pets for Life serves. And as you can see, there is very little access to veterinary clinics or pet supplies. And when you are in an area where maybe you don't have transportation and you can't get to that vet clinic, you don't have a lot of options. So we need to think about how many areas. There's a lot of Appalachia area. There's a lot of rural areas that, and they estimated in 2019, 1 in 7 counties was underserved by a veterinarian. So that is a big issue. And that's why it's so important. Like when you see San Diego and SPCA of Texas going out into the community and doing outreach, we need to do that. So we imagine a safety net partnership in every community, and we're starting to see more of that, where the shelter has like hotlines and intervention at the time of surrender, as well as going out into the community. We're seeing it also with private practices starting to provide payment plans and medical funds and working with nonprofits. And then on the human healthcare side, starting to provide. And one of my favorite stories is actually the Spay Neuter Network out of Texas. So they actually are doing a really interesting thing where they just started a pet support hotline since COVID, and they're answering the calls off of their 311, or if you have a 211 system, they've agreed to answer all of the calls. They've answered 2,100 calls since COVID began on animal related issues, and they've been able to keep 69% of those out of the shelter by just referring them to resources. What an amazing collaboration of answering calls are already coming in, but providing those resources. So our role so I have 2 vet clinics. One is called Open Door Veterinary Care in Asheville, North Carolina, and there's Community Pet Care Clinic in Toledo, Ohio. And we started based on the premise of that all pets and people should have access to veterinary care. And one of the things with this was, how can we create a sustainable business model where we can show veterinarians that they can still make a revenue and help people in need without having to turn them away. So we've been working on that. We've been able to do that and actually make a profit in our for-profit clinics while still doing it. And the ways we've done it, because one of the big things we realized is that with people, probably about 10% of the population can actually afford veterinary care right now. About 80% of the population can afford it with some help. They're kind of the illiquid. So they have enough money if they could make a payment plan, or if they could get a little bit of support and they didn't have to pay it all right now, that initial $400 or $1,000. So they just need some time. And then that other 10% they're insolvent, where they really are going to need some help and support and able to get vet care. And so what we really focused on doing was, we want to create a program that helps all of these, but that really allows, just by reducing the cost up front and by working with payment plans, we can get 90% of the people, so that then we can really save the grants and the funds and the nonprofit to really focus on that 10% of the population that is the most vulnerable and needing that help. And so one of the ways we're really doing that is with in-house payment plans. So we actually work with a group called Vet Billing, which I'll talk about in a minute, because we do offer care credit and we offer scratch pay. But what we're finding with these conventional third-party financing is that only about 60% of people qualify. And the reason that a lot of people don't qualify is not because they have bad credit, but because there are inequities. So maybe they're on a fixed income because they're elderly or they're retired. Maybe they don't have an established credit history. They're recent college grads, or they're just entering the field. Maybe they're rebuilding or repairing their credit, or they don't have a mortgage, they rent. So things like that go against them. And we're also finding that there's a disparity between minorities. So Blacks and Hispanics are actually, whites qualify at there's a 7% rate. They qualify, turned down at a 7% rate. Blacks and Hispanics are turned down at a 15% rate. So there's some disparities in how the third-party financing works. And again, it's not because of bad credit. It is because of these types of things that are already making it harder. So then when pet owners have nowhere to go, what are they going to do? They're going to have to get predatory loans. They're going to have to go without care. They're going to have to do GoFundMe. So this is where we really look for incremental care and financial options and meeting people where they're at today. So the first thing we do when people come into our clinics is we look at, will running that diagnostic or that test change the course of our treatment? And if it doesn't, we're not going to run it. We really try to focus on treating the symptom before running the full diagnostic. And this does not mean that we cut our quality or that we do not do the best care that we can. This just means that we take a step-by-step incremental approach to get there, working with the people within their budget. So that may mean things like we script out, we do generic medicine, we treat parvo outpatient instead of in clinic, which we still have a great success rate. Things like that are what we're going to do. For chronic issues, we'll use telemedicine to check in with them on how they're doing with diabetes. We actually, we'll work on things like that to make it easier for people. So what we do with the plans, we have payment plans, and we work with vet billing. And what that allows us to do is we can set clients up for anywhere from 6 months to a year for a payment plan. And a lot of vets have been very resistant to do this because they think that they're going to get burned and they aren't going to get paid back. And what we found is because vet billing does all of the collection for us, but it's also not a ding on their credit, and we can set it up. They actually have a 97% repayment plan, and it works really well. And we found that people actually are so excited just because they hear we have payment plans that they actually now call us to see if they can, thinking that now that they can afford the care. And a lot of times they don't even need it. They don't even need the payment plan because then they realize they can afford it, but they wouldn't have called if they didn't think there was that option. Also, thinking about millennials, there was research done that shows that millennials like to have payment options. They like to be able to go get their shopping cards, their credit cards. They like those types of options. So that's another good reason for us to offer them, is for the younger population. But it's also geared towards people who don't qualify for care credit or scratch pay. So it's been a really great option for us. We also do pre-savings plans where people can save up for a dental or a surgery that they know they want to have by saving money, and it goes into an account with us until they have enough. And these are things that nonprofits and vet clinics can set up. On top of that, we do also have a Stay Together fund where we give $1 back from every exam fee, and that goes into a fund, and then we give that to our vets, and they're able to use that for their clients in need. We also partner with nonprofits, and this is where I think it's really important for private practices and nonprofits, because traditionally there's been a little bit of almost, I guess, a disconnect of, private vets thinking that nonprofits are taking their revenue, and nonprofits thinking that vets don't want to work with them and don't understand the issue. And this is a great way for both to play a role instead of trying to do it all. So we work with Asheville Humane Society, who has a community solutions program. They get about 350 calls a month. About 150 of those are for vet assistance. So they will pay generally about $150. The clients come to us, they give a voucher, they send it ahead of time, and then we will do the medical care, and then we just bill Asheville Humane. And a lot of times we'll work with them for so much, and then we'll use some through our Stay Together fund, so it's a nice collaboration. Asheville Humane does a lot of collaboration with homeless coalitions, the housing authorities, veterans associations. And what's interesting is that they actually have worked to get cross-trained. So they have actually worked with social service agencies, and they've gotten cross-trained in looking for human abuse when they go in to deal with pets. And the social agencies have gotten trained in looking for pet abuse when they go in. So it's a really great collaboration that the Humane Society has done. And I think this is something that a lot of nonprofits can do. If you want to work with private practices, set up a medical fund and reach out to them and work with them, because it really gives the vet practices a really nice option of being able to help and being able to not have to say no and be able to work with you. Well, I want to talk really fast about an Uber pilot, which is a really interesting thing that Best Friends Animal Society is doing. We're actually testing with SPCA of Texas and San Diego Humane and some others, but basically groups will be able to go into Uber, have their own dashboard. They will be able to sign people up when they need to have a trip. So what they'll do is you can either pay for the entire trip, or they can actually pay for a portion of the trip. And the pet-friendly drivers will come and work with this. So we're testing it right now with 5 organizations, and we hope to then make this nationwide so that we'll be able to help solve a lot of the transportation issue, and groups will be able to help provide the cost for people without transportation. So stay tuned for more of this, and if you're interested in it, you can email me and I'll fill you in more. Integrating social workers is something we just started doing. We're actually partnering with Ohio State, the University of Toledo, and Bowling Green, and Janet's going to talk a little bit about this as well. So we now, we really wanted to get a veterinary social worker in our clinic, but there weren't any in our area. So we actually were able to find through Janet a social worker who's going for her master's. So she's with us August through April, and she actually is now helping us with put together some grief counseling for our clients, which is huge because we are doing a lot of euthanasia right now. She's helping get a pet support guide out to social workers, which list all of the resources so that social workers will know how to connect into temporary boarding and pet food banks and low-cost medical care. The other thing is she is working with us on getting a question on social workers questionnaires that ask, do you have a pet and do you have any concerns with your pet? Because we're not often the first person seeing the pet. A lot of times it's coming from the social work perspective. So if they know how to connect and we know how many people that are seeing social workers have needs for pets, that helps us identify what programs we need to do. Janet was also able to get a question on the homeless census that actually asked if they had pets, because when we initially reached out to our homeless human organizations, we were told, oh, homeless people don't have pets. They don't have time for that. And we thought, gosh, we know that's not true, but we didn't have any data to show that. So now we actually have that on the homeless census so that we can now show that people who are homeless do have pets. They might not be able to take advantage of those services because the shelters don't allow pets and they don't want to be without their pets. So this is a great way for us to actually show the connection so that everybody sees it on each side. And then also one of the things we're doing is the social workers helping us with training for staff on dealing how to diffuse difficult client situations and diffuse yourself, because the veterinary world right now is seeing a lot of people getting very angry about wearing masks, about having to wait. And it's really burning out a lot of our staff. And what's happening is then our staff is also not seeing the best side of people. Even though they're in this work because they want to make a difference and they care, they're burned out and they're starting to see more of the negative side. And so we want to help give them tools on how to help people and how to see it from another position. So they're really, the social workers really helping us with that. And we're hoping that this is going to be a model that we can show other vet clinics how to do and incorporate as well. And that's really something that you can do. You know, reach out to social services, see about getting pet questions on a homeless census, on a social worker questionnaire, and do the cross training like Asheville Humane did between your staff in the shelter and the social workers. And then see about setting up a social work internship, because that would be great to have in shelters as well as vet clinics to be able to provide this type of work. And here's the pet resource guide. This is from Dallas Animal Services. A lot of groups are starting to do this now, but I think the key is getting it beyond just our circles and getting it into social workers' hands so that they know how to reach out to and they know how to connect pets to resources. And another thing is that we can do right now is doing a lot of partnerships. So we're reaching out to work with nonprofits. So we're going to start doing, though, our vets are going out and doing a pop-up. So once a week, we're going to a different area of town. And we're starting by going out into housing areas, because one place we think that we can really help is helping renters get vaccines and get their pets spayed neutered to show proof to landlords, so that if they do lose housing or if they do need to show proof, they're already set up. So we're going to start by going to Section 8 housing, by going to senior housing, and going where human healthcare providers are already providing that type of healthcare. And so I think that's a great way that we can also partner. And then last is a heart program, which Janet's going to talk about, so I'm not going to get too much into, but there's this really cool program about an emotional support animal placement between our local Humane Society and our local human hospital that I think can be a model nationwide. And our clinic is providing the medical care for this. And I am super excited about it because I think, again, this is a great example of One Health. So I am now going to let Janet take that over and start telling you more about it, if I can figure out how to turn off my video.
Thank you so much, Aimee. It has been so inspiring to hear all the ways that the veterinary organizations, animal shelters are working and innovating to keep people and pets together. So next slide, please. I'd like to share briefly how I, as a social worker, got here, and even literally here, like on this webinar today. as I mentioned, I worked for many years in mental health, public mental health. One of the things I did routinely was suicide risk assessments with people as part of a job I had doing crisis intervention. One thing I always asked people was, what has stopped you from acting on your suicidal thoughts up until now? And what I was asking that question for was to basically identify what was keeping them alive, what was their lifeline. And I would hear the usual answers I'd been trained in my education and, post-education training to expect. I'm afraid, what would happen to my children. I can't do that to my family. It's against my spiritual beliefs. But often enough that it struck me, people said they were not killing themselves because they did not want to leave their animals behind. And two things about that struck me. The first thing is, as a quote unquote animal person, I totally got it. I got having that kind of profound connect with an animal. The second thing that struck me was, as a human service provider and mental health provider, nothing, and I mean nothing in my education, in my training had taught me to even consider that animals might be a protective factor in human health and well-being. And yet here I was in this job hearing over and over people saying that they were literally still alive because of the connection they had to their pets. So that was a good couple decades ago, but that's what really got me to begin focusing in this direction. So fast forward to now, as a social worker, a big part of my focus is working with health human service providers that provide services to people to help them understand why it's important to be responsive to their patients' and clients' pet-related needs and how to do that. And a big part of how is partnerships like we've been hearing about with animal protection and veterinary organizations around common goals. What I'm going to share with you more on is the why part that is getting human, service organizations to pay more attention to the human-animal bond and getting them to start becoming responsive to helping keep people and pets together. And my hope is that that's going to help better equip you to be able to engage in common goals with them. So this is a study that just came out 2020, and you'll see in March, and there was next to no publicity on it. Unfortunately, we know what was happening right about then in March. That was, COVID, but big study out of Australia showing, back what I was, becoming aware of 2 decades ago, pets indeed can help prevent suicide in at-risk populations. Next slide. So again, the why should people that work with human health and service in general care about pets? First of all, this isn't a niche thing. When people hear the kind of work I do, they often will say, "Oh, well, you do animal assisted therapy," and certainly there's a piece of that, but it's much broader. The American Pet Products Manufacturers Association does the biggest demographic survey on pet ownership in the United States, and their most recent found 68% of people report having at least one companion animal, and the majority indicating that they consider their animal to be family. So this is most people that health and human service providers in the human sector are going to be interacting with. They're going to be having animals, and of them, the most will, going to have animals they consider family. Next slide. So quick question here, you don't have to answer, but just looking at these pictures, can you tell which pair just met literally minutes ago and which pair has been together 12 years? I can say I couldn't if I didn't know, because I put the slide together. The answer is the pair on the right has been together for many years. The pair on the left just met. But if we look at both of these pictures and look at the expressions on these people's faces, I think we'd all agree that there are some positive things happening in both of these situations. My point being, the human-animal bond, having an ongoing relationship with an animal, has powerful benefits, which I'm going to share with you briefly. However, just brief interactions like on the left can also be significant for human health. Next slide. So these natural benefits of human-animal interaction, there's emerging science and research coming out that support each of these types. And I say natural, it's really about the affiliated connecting kind of behaviors that animals that are domesticated offer up to us, and affection and attention, kind of soliciting or offering behavior. And they fall along the basic dimensions of our human functioning: physical, psychological, emotional, and social. Next slide. So the physical benefits, I think probably the most obvious and straightforward: increased activity. If we have a dog, we have the little picture here with the dog with his little leash, that's going to get us walking more. However, kitties too will have us possibly playing or grooming or doing what we need to take care of them. The benefit that's got increased attention in recent years is what we'd call contact related. That it happens through petting, holding, snuggling, and now contact is even extended to include eye contact between bonded people and their pets. Studies have shown results in oxytocin release. Oxytocin is a bonding hormone that is released when we're interacting with a person, and now we found, or an animal that we have a strong attachment to. What's the important thing about oxytocin? It has a whole cascade of health benefits: lower blood pressure, lower heart rate, lower respiration rate, decreased cortisol, which is a stress hormone. So having just simple contact with our pets literally can change our physiologic functioning and help us to feel better. Next slide. And this isn't even new news so much anymore. This is a statement that came out in 2013, so now 7 years ago, from the American Heart Association, acknowledging the links between decreased cardiovascular risk and pet ownership, particularly with dogs. And to be clear, they're not saying go out and get a dog, so that's going to take care of your heart issues, but they are saying it does reduce risk if you have animals, and even recurrence of heart attack issues. And yes, I can absolutely provide links to this. Next slide. So research around what we'd call psychological benefits. And this is certainly not exhaustive, but we have roles: sense of purpose, feeling needed, self-efficacy, feeling like you can do something, do it well. The last that I have listed here, behavior activation and motivation. I know we have Dr. Mary Raucus in the audience from the University of Pittsburgh, and she had interesting findings in a study on food insecurity, where people accessing a food bank, they looked at people with pets, people without. The thought was people with pets would have more food insecurity, right? Less, ongoing accessibility to food resources in areas where that was a struggle. Because again, the thinking was they were sharing what they had with their pets and then having less. What they found was the opposite. People with pets actually reported less food insecurity or issues with food. And then they fortunately followed up with what we call qualitative interviews, open-ended questions. What was going on with that? What they found was people were actually reporting they were motivated to go out and get their pets food, and then when they were in the process of doing that at the food bank, they got food for themselves also. So the pet literally was a motivating factor for their self-care. Next slide. These are social benefits, emotional benefits. This would be the header. And I think these, again, kind of fall under like increased activity. These are the ones we might think of: less feelings of loneliness, comfort, affection, having an animal with somebody. With the increased research around social isolation and loneliness as health risk factors, this is getting a lot of attention. How can animal companionship help ameliorate health risks related to isolation and loneliness? And there's even been sort of paralleling isolation and loneliness to being like, similar to smoking or being sedentary in terms of the extent of the health risk. Next slide. So dovetailing right to the social benefits, again, we've got what we'd call direct companionship from the animal, However, there's also what we call indirect, which is basically that having an animal creates a bridge to other humans, people that we might not otherwise talk to, but that smile at us when we're walking our dog or overhear us talking about our cat and want to see the cell phone picture. For, you know, those of us that have many social connections, that can be enjoyable. For people who are more isolated, this can be a crucial kind of connecting factor. Next slide. And these don't happen in isolation from each other. Rather, they happen together in our body. Research talks about the stress mediation effect, which is basically the combination of the physical things that happen, say like when we're petting, decreased blood pressure, heart and respiration rate, and the emotional feeling good that we get when maybe holding our animal, petting, looking into their eyes. And how all of these together can help us to feel good generally if we're struggling with anxiety, which, for example, has a number of physical characteristics: heart rate, respiration rate, blood pressure going up. Interaction with our animal can help directly ameliorate some of that. Next slide. And here's an example of that. Cortisol, heart palpitations, shortness of breath are all part of our stress and anxiety reaction. The comforting physical contact with our client and the combination of those benefits can work together to literally help reduce some of the physical symptoms as well as the emotional feelings. Next slide. So those are what we call the natural benefits of human-animal interaction. Top picture in this slide showing cuddling. And I'm pretty positive that that kitty in that picture was not trained to do that. Kitty is just being affectionate. My guess is both of them have oxytocin going on, depending on how long they were snuggling. And all of those different kinds of benefits we just looked at can be therapeutic. The other way animals can be very impactful to human health and well-being is through task training, where the animal's taught to do or trained to do specific things or tasks. And if we look below, there's a dog literally guiding somebody across the street. And there is a ton of training that needs to go into the dog being able to do that in a way that helps that person to function more independently. Next slide. So if we think about the roles of animals and how these benefits, the task training, the natural benefits can affect human health and well-being. At the far left, we have the animal emotional support animals, which basically don't have much of any training to offer the therapeutic benefit other than being friendly and interactive with their person. At the far right, we have service animals. These are animals that literally have thousands of hours of training at times and have thousands of dollars then invested in their training. And the dog here guiding somebody with a visual impairment, often referred to as seeing eye dog. These are animals that actually have to be trained to do what we call intelligent disobedience. Like they have to disobey if they're told to go into dangerous situations. So lots of training. Next slide. More on service animals. Training to do specific tasks related to a person's disability. That disability could be hearing, mobility, psychiatric, seizure alert, diabetes, many different kinds of disabilities. The crucial thing here is service and assistance animals are trained to do specific things. These are the only animals that have what we call public access, the rights of the person to bring their animal into a public space that, you know, everybody else would have access to. And that is through the Americans with Disabilities Act. None of the other animals in therapeutic roles are recognized in the ADA as an animal that a person has a right to bring into the public spaces. There's a lot of confusion about that, so wanted to clarify. Next slide. Registered therapy animals. These are kind of our social butterflies of the animals in therapeutic roles. They help many people. The service and assistance animals are trained to assist one person. These are animals that are super well behaved. They need to be because they go into a range of settings: schools, hospitals, nursing homes, hospices. and they help provide those natural benefits we looked at earlier to different populations of people that are vulnerable or in need because of health or crisis. Thank you, Abby. Clarification, the term assistance animals legally indicates a different classification. It gets confusing because the accreditation organization for mobility and other kinds of task-trained dogs actually calls themselves Assistance Dogs International, but they're working under numerous countries' laws, not just the United States. So, and if there's further questions about that, I'm happy to address that. Emotional support animals. Okay, these are companion animals or pets. They don't have special training. They help people through, one person in particular, through the natural benefits of human-animal interaction. What makes them have a legal status is a letter in writing, typically by a licensed health care or mental health care professional. Doesn't have to be for fair housing, can be a knowledgeable person, quote unquote, but often the expectation is that it's a health or mental health professional. That this letter then indicates that the animal is necessary and that the person does have the disability under Fair Housing Act. Next slide. Disability, different definitions and different policy. In terms of housing, which is, definitely been talked about today as a barrier for animals or people with animals getting into housing. Fair Housing Act defines very simply having a physical or mental impairment that substantially limits one or more life activities, and has recently added clarification. People that have already been diagnosed with major depressive disorder, bipolar disorder, post-traumatic stress disorder, obsessive compulsive disorder, they automatically meet this definition. So they don't need additional assessment to determine that they meet the definition of disability. If they have been diagnosed this by a care provider, that qualifies them. Next slide. Why is that important? Again, kind of going back to some of the housing barriers that people face, and many people aren't aware necessarily that they may qualify to have an emotional support animal. Once the letter is written, this animal is considered a disability accommodation, not a pet, under the Fair Housing Act. Therefore, people with ESAs can't be prohibited from living in no pet housing. They can't be charged pet deposit fees. They can't be charged monthly fees. They are responsible for damage. If there's disturbances, that's followed as any disturbance would be in an apartment or, type living setting. So it's not, blanket, anything goes, but this is very specifically looked at the animal as an accommodation, not a pet, once that letter is written. What is needed in the letter? If you're getting it from the healthcare, mental health care provider, ideally letterhead, full name, date, and a statement. Next slide. Here's just a simple example. The person's name, that the person writing it is familiar with the condition, the treatment, the limitations. You notice the condition's not listed. It does not have to be. That it meets the definition under the Fair Housing Act of disability, that the person needs the animal to help due to their condition, and signed with the person, if it's a healthcare professional, their name, title, sometimes license number. This is what's needed, not anything that's online that would be, for a fee, that there's vests, certificates, registries, lots of predatory kinds of things out there. This is something somebody can get from their primary care doctor or their counselor or their case manager. Anybody that's familiar with their condition and that understands how the animal, can benefit. This can be written for somebody who already has an animal that's helping them. This can be written for somebody who doesn't currently have an animal, but needs and is planning on getting an animal to help them with their functioning. So In terms of, next slide, animals that can serve as emotional support animals, any, animal that is friendly, at least to the person, and socialized, healthy. Those of you that work in animal, sheltering, you're already experts and matchmakers. It's essentially like any adoption. You look at the temperament, the energy level, the care needs, the size, what the person's capable of generally. There is an article that the AVMA put out last year, and I have the link up to that. It is open access with some more information about helping shelters and veterinarians around identifying possible emotional support animals. But it's really about, in our placement program, we have a really high energy young dog that's with a high energy young man, and they're perfect together. We have a couch potato older dog that loves to just lay in the lap, and she's with somebody that's perfect for. So it's like any, placement matchmaking. Next slide. And an example, Aimee had mentioned the Hope and Recovery Pet Program. This was developed through a collaboration between a regional human healthcare and hospital system, a Humane Society, and my university. So essentially, shelter animals from the Humane Society are placed as emotional support animals with individuals referred by their healthcare provider who may not otherwise be able to afford having the animals. So there's a number of supports available through this program as well. Pet food, veterinary care, as Aimee said, we work with her community pet care clinic around the veterinary care provision. And this is really a One Health program. The goal is twofold: to improve human mental health and to help animals in need of homes get into those good loving homes that are vetted and screened. And I'm aware of time, so I'm just going to bounce through the next slides here. Go ahead. Essentially, there was a study. We looked at what happened before and after people had these animals, and after they had them and lived for a year. We had statistically significant reductions in anxiety, depression, and loneliness. While not significant, we had significant, visual consistent pattern of increases in people's oxytocin and decreases in their cortisol after they interacted for 10 minutes with their animals. How did that happen? We did home visits at 1 month, 3 months, 6 months, 9 months, 12 months post-placement. I got a saliva sample, asked them to interact with their animal for 10 minutes, and got a second saliva in. So these people were with their animals all the time, but when they focused positively on them, that was my alarm. Sorry about that. In terms of how people explained their improvements, which I think, again, was helpful because a lot can happen over 12 months. So what was really the anxiety, depression, and loneliness about? The improvements in that, people overwhelmingly indicated they felt their animals were the game changer in terms of improving their mental health and well-being. Next slide. So these are graphics that you can look at, but this was over the months of the study, where the oxytocin would increase after 10 minutes, cortisol decreasing after 10 minutes. Next slide. And thank you so much.
Thank you. I know we all went over. I was probably the worst offender, but so thank you all for sticking with us till the end. And I would just like, because Janet didn't get to go into it as much as she had time for, is the emotional support program that she has done with the Humane Society is a really cool option for getting more animals into placement and helping people as well. So if you want more information on that, please contact us because I think that will be a great thing for people to see across the country. So we are out of time to answer questions. I see we've been answering in the chat, but if anybody does have any follow-up questions, please send them to us. I think we're all so excited to talk about this topic. You can see we talk way too long, and you will be getting recording off of this. So we really thank you for your time, and we hope some of these things will be able to be put into your communities as well. Thank you for joining.